Okay, I chose for my genetic disorder to do Tay-Sachs disease. Um, it's mainly something that affects the Eastern and Central European Jewish communities. It's a disease that's genetically inclined to where, like, if the mother's a carrier and the father's a carrier, then each individual offspring with each pregnancy has a 25% chance of developing that disorder or disease. So the main cause of it, it's a defective gene on the chromosome 15. The defective gene causes the body to not make a certain protein, the hex A. Without this protein, chemicals called gangliosides build up in the nerve cells of the brain and destroy brain cells. Some of your signs and symptoms, usually with this, they they're hard to tell because you're born with it. So in the first 6 months, as you're developing, um, you're going to have some developmental delays that maybe you're not going to realize are there. But some of the things later on that you can start to see signs of are muscle weakness, coordination issues, stiff muscles, faint feeling, difficulty swallowing and speaking, hearing loss, seizures. You can see cherry red spots on the eyes, and then later having loss of vision altogether. It mainly affects just like your nervous system. So coordination, hand-eye, the pincher grasp that the kids usually develop after a few months of age, that's delayed. So you really need to watch their like the things that their timeline of things that they should be doing that they're not doing as of yet. So some of your diagnostic testing with this. If both mom and dad are a carrier and you already know this, you can do an amniocentesis around 16 weeks gestation. If you don't know if mom and dad are a carrier and you want to find out, then you can have parental testing done by performing a blood test for the enzyme assay or the DNA testing to see if you're a carrier of the Tay-Sachs disease. Prognosis for this usually it is in every case fatal, but usually there's not a lot of cases where the child lives more than the age of 5. Usually 4 or 5 is basically everything that I found with this disease. Treatment, there's literally no cure for Tay-Sachs disease that's out there. You're basically looking at palliative measures for the child. Just keep them as comfortable as you possibly can. You can do supplemental medications to help with some of the signs and symptoms, like the seizures, and you can do physical therapy. At some point in time, you're probably going to need to do a feeding tube to help these kids get some nutrition to prolong the inevitable of what's going to happen. However, there is lots and lots of gene therapy and enzyme replacement therapies currently underway that they are trying to get a study going and things like that to try and help, if not only to actually cure Tay-Sachs disease, but to prolong the life of a child who does have this. Um, so as of right now, it may eventually lead to a cure, but as of right now, there are no advances that have been made for this, for supplementing that enzyme, or the being able to fix the chromosome 15 that is defective. So that's all I got. Thanks.